of diabetes, which were variants of the norm, so to speak. And in actual fact, these sorts of clusters have been quasi-replicated in other populations, okay? The problem, of course, is that it depends on what knowledge is fed into the cluster analysis. It is knowledge that all of us have when we see that particular patient, because these were all anthropometric variables or simple lab tests, okay? And I think we can typically work out when people are insulin deficient and or insulin resistant. I think we can work out if a patient is lean or obese based on clinical examination, and we can figure out the age most of the time, okay? So whether we cluster people or not, perhaps the bigger question is whether these subgroups might be associated with outcomes. And to some extent, they do. So for example, in this cluster, you can see the dark blue and the light blue clusters are the ones which take the longest to get to an A1C of 6.5 or less, okay? Those are the insulin deficient and insulin resistant clusters, okay? Not surprising that they're going to be more difficult to treat. But at the end of the day, the treatment was incremental. You try a medication, it doesn't work, you change or you increase. And in fact, they were the groups more likely to start insulin early. So in practice, I would give to you that whether you lump a patient, it's interesting, when people try to individualize diabetes care, they end up lumping patients into clusters, which is kind of anti-ethical, right? If you're trying to individualize care and then trying to categorize patients into clusters that may or may not fit exactly. And again, similar analysis with lipids. So basically, the cumulative incidence of cardiovascular disease was highest in the cluster with the highest triglycerides and the lowest and the highest LDL. Not exactly surprising, okay? So again, you can make a continuum of risk assessment based on the lab data you have available to you. Remember this slide that I showed you? A couple of years ago, we decided that we were going to look at it in more detail, because remember, fasting glucose here was categorized in categorical variables, in a sense, in 3 bins.